In terms of vacuum pumps causing Peyronie's disease, I don't believe I've ever seen that in my case studies alone. I think it's only actually something that is advantageous to help. Typically, if I provide the ultrasound therapy or even now shockwave therapy, I know there's going to be like a treatment effect for the next 24 to 72 hours. And it's during that time that we can potentially get a good stretch by applying the vacuum therapy within that time frame to basically build on the treatment. So we're trying to basically disturb the tissue, get increased blood flow, get an inflammatory response to come in and kind of do a self-sweeping effect. And then we want to lay down those tissues and the newly oxygenated blood coming into the area in a better form. And that's where stretching is, with a vacuum pump, like stretching a hamstring tear. There's really no difference. It's still muscular tissue that we can work with. And I think vacuum pumps only have a good role to play in Peyronie's disease. We determine whether or not it's a severe Peyronie's by the angle of curvature. So if it's more than 60 degrees, we would basically want to try and work with that and maybe get it surgically corrected. If it's under that, 30 to 60 degrees or less, I think the VACURECT is absolutely fine. VACURECT is also my favourite go-to one. In fact, I was lucky enough to meet the wife of the original designer from that in South Africa after he'd passed away with prostate cancer. So we had an engineer designing that, and it's a really good pump. It's really user-friendly and it doesn't make any noise and it's not big, so it's easy to travel with as well. It's also, I think, at a really affordable mid-range price for its quality. But if it's a situation where we want to increase the improvement and not do surgery or try and hold off from surgery because we're in that window, there is one called the IMED SOMACORRECT that you can get from the United Kingdom. That's the only one that I know of, and I've actually used it in practice, that is specifically going to assist the curvature. And the way it does it is a normal vacuum flask with smaller size cylinders that you insert as an inner tube. So sometimes with Peyronie's, when men do actually inflate the penis, the curve starts to upwardly bend or hit the roof of the cylinder of, say, the VACURECT. And that upward curve or that changing is something we really don't want to have happen. So that's where, if it's a more severe curve, the IMED SOMACORRECT is the only one I've come across that will try and splint that particular severe curve within the vacuum flask. They're a little bit more expensive and you can only get them through the UK, but I have probably recommended about 40 or 50 patients require those, and in most cases it prevents men having to have surgery.